This is Jerry Hesch, and I'm presenting a whole body workshop. And I have a most fascinating client, and I evaluated her yesterday, and it's something that I see so very rarely, and I hope that we're going to make an effect on your presentation. And so if you would kindly give us a little bit of background on your presentation.
I came to Jerry initially because I've been having an issue for the last 4 years where I had been horseback riding and kind of overdid it over the course of a few days, and then went to a show. And at the end of the show, I couldn't walk. I had pain, severe pain, sharp stabbing pain in my groin area, and felt like my femur was jammed up into my pelvis, into the joint, and I couldn't get it unstuck. So over the course of the last 4 years, I've been to many different types of therapists. I did not go to the doctor because I really don't feel that it's a problem that the doctors are going to be able to resolve without surgery, and that's not the way I want to go. So I went to chiropractors and massage therapists and did some exercises and stretches and a lot of stuff on my own trying to figure it out, and just hasn't been able to get resolved. A lot of people had a lot of different theories. None of them seemed to really pan out. So I came across Jerry's work in a book, and when I heard he was coming to town, I thought, boy, you know, maybe he knows something. And apparently he says he does, so I'm pretty excited about it. So that's where we're at today.
I'm not sure I made that claim, but what I did claim is your case was certainly very interesting.
Yeah.
So if you'll go ahead and lie down, but what I do want you to tell us, what does this injury prevent you from doing?
Well, I'm pretty active, you know, up until this, and even beyond as I was trying to work my way through it. I'm a massage therapist, so I'm on my feet all day, working with a lot of different people. I do canine search and rescue, where I'm hiking up and down through the woods, you know, not on the trails, so it's pretty tough, rigorous hiking.
So you are looking for victims?
Yes, looking for missing people, using the dogs to do that. And that's become pretty difficult. I've had a couple different injuries over the course of the last few years. You know, just my body's not moving right. It's difficult actually to play properly with the dogs because you really have to get up. You have to be able to be, you know, really strong to be able to play with these dogs and be quick on your feet. So I've gotten bitten a few times. Not the dog's fault, but my fault for not being as fast as I feel like I should be. And I also ride horses. I do, you know, all the barn work, you know, throwing hay, trying to do all this stuff, and I just feel like there's no oomph left in my, you know, in my abilities to do all this stuff. So, you know, it's, you get older, and I hear a lot of my clients say this, and I was kind of surprised that my brain was going in this direction, but when we spoke yesterday, I heard myself saying, gosh, well, you know, I'm getting a little older. And I'm like, no, it doesn't work that way.
But you've worked hard to strengthen and do things for it.
Yeah. I mean, I stay really active. I mean, I'm on my feet all day. I'm working. You know, I'm still riding. I'm still doing barn work. I'm doing search and rescue in a limited capacity at this point. But I'm always worried.
You said something about your core, that you felt like you couldn't engage it anymore, or something like that?
Yeah, like, you know, I mean, in different aspects in things that I'm doing, like when, you know, when you're trying to play with one of these dogs, you know, you have a tug toy, and the dog is, you know, coming at, you know, they're trying to play, and you got to get in this stance where you're nice and open, and you have this strong, you know, core that's going to keep you with the ability to move fast. That's definitely gone downhill. And then when you're throwing, you know, taking hay bales, you know, you got to pick the bale up, and then you got to be able to twist and throw at the same time. So that's some pretty major core work. That's really hard. In talking last night, we were talking about my inability to do crunches because I use my neck muscles to do a crunch, and it hurts too much, so I don't do crunches anymore.
So we'll stop this film and then we'll film again immediately to show the assessment part. Just a quick summary of our findings. So go ahead and stop.